Hello, everyone. Welcome back to another round of podcast. I have a very special guest with me, Dr. Karan Mittal, today with me. He's a holistic psychotherapist and he specializes in the holistic integration of body, prana, mind, and soul, drawing ancient wisdom and modern science. So, Dr. Karan Mittal, welcome to the podcast.
Thank you, Parji. It's a pleasure to be here with you talking on therapy.
Yeah, beautiful. Yeah. So, Dr. Karan, I worked with Dr. Karan a couple of years back, and it's been amazing. The amazing insights into therapy and all the stuff he does around healing. Dr. Karan, maybe do you want to give a little bit more detailed understanding of what's your specialty and what's your background in this?
Sure. So basically, by training, I started with my graduation in modern medicine. So in India, I hold a modern medicine degree. But because of my deep interest into mental health, then after my graduation, I switched to more of psychology and psychotherapy. And I did my double master's in psychology. And I'm currently also doing my PhD in Indian psychology, in the sense how are Indian scriptures conceptualized the psychology. So that's my basic background by education. And also along the lines, after doing my medical graduation, I started learning therapies. I started, kind of doing different certifications. So I got certified in different therapies, right? From clinical hypnosis to CBT to the modern therapies that exist in the world, and also the third generation therapies like mindfulness based therapies, etc. So a couple of therapies were added to my CV, because for every client, I thought just a single therapy doesn't work well. And because I hold a very deep interest in the Indian tradition, I also kind of learned more of Indian scriptures, and especially with my Indian clients, I tried to add the flavor of Indian concepts of karma and, different Bhagavad Gita concepts, because it's more relatable to them, and they can kind of, that insights that come from scriptures also help them. So it's not like I tell them this is what the scripture said, but it's an insightful discussion where we take up the concepts and try to integrate it with modern therapy.
Yeah, it's beautiful to see you're blending all the modern concepts of the therapy along with the ancient wisdom. And that's like a unique, I would say, blend in itself that is probably not found anywhere else. So thank you for doing what you do here.
Thank you.
So for our viewers, maybe there is, I would say, at least this is my observation, that maybe a lot of, let's say, Gen Z and all of the uh, youngsters out there, they're all kind of, let's say, getting some notion or some familiarity with therapy, but there is a lot of still skepticism within the Indian society about mental health, about like issues with mental health. Maybe help us understand, like, when would somebody need like therapy to even begin with, and what exactly is this?
Yeah. So I think the problem with the notion or the concept of therapy is either people have too many, kind of taboos. And as you said, people are hesitant and skeptical about it. There's that group of people. And there's a group of people, because of the today's social media trend, etc., kind of, use the concepts or the labels of therapy very loosely. So it's very easy for a person to say, I have ADHD, I have anxiety, because people use these concepts very loosely. So we have two diverse groups that we deal with. But I would say therapy is not just probably a talking process, or probably somewhere I am, sitting on a chair and trying to give a monologue instruction. So it's not like a dominance thing, but I think it's more like a structured treatment. Like we have structured treatments for different physical diseases. Similarly, we have structured treatments for psychology also, for our mental health issues also. And that's what is therapy. So like I would go to any, for a doctor for treatment of diabetes, tension, or a heart issue. Similarly, if I have issues with my day-to-day functioning, if I have issues in dealing with people, if I have issues post someone's death or loss or anything of that sort, when I'm, struggling to cope, I can always approach a therapist.
Nice.
That's therapy in short.
Got it. So basically, in a nutshell, like somebody having, you could say, range of emotional, mental issues where they are not stable enough to, let's say, function on the day to day, that would be a good time to kind of take this as a good tool to heal themselves, right?
Yes. Usually give a window frame where looking a few weeks or few days is fine. But if you have a, constant issue, maybe for months and weeks together, then it's good to approach a therapist. At least get yourself evaluated. If not get into proper therapy, a proper clinical person might evaluate and let you know what's the best way ahead. So that's therapy.
Yeah, got it. So in these days, I mean, there is like range of issues, let's say, starting from somebody going through tough times in their childhood to, let's say, depression, or I mean, there's so many youngsters now who have gotten into addictions, drugs, alcohol, pornography. Help us understand how therapy can, help in dealing with this kind of broad range of, issues that different people are going through in their life, right? And even
Yeah.
breakups, relationship breakups, or problems in the family. I mean, all of that is accumulating, right, in the society today.
So like, treatment of different physical disease, because I'm using the analogy of physical disease because I'm a medical doctor by also education. So, like treatment for different diseases is different, and we have different specialists for various organs of the body. Similarly, for therapy also, for different types of therapy, there are mental health specialists that specialize in different ways of giving therapy. Like there are different schools of thought, and they also specialize in different kind of issues. So there might be people that specialize in basically depression and anxiety based issues. There might be people who really specialize with addiction work, BPD, bipolar disorders, or there are very hardcore therapists who deal with people having suicidal tendencies or psychosis. So like we have specialists in the physical field area. Similarly, we have a specialist in the mental health. And for every issue that you said, probably the kind of therapy that works the best as per researchers, of course it's not for the therapist to decide, but there are many trials that have happened and many researches that have happened, and for every issue there might be a different therapy that can give you the best possible result in shorter amount of time. So trying to kind of, and a good therapist always kind of refers you, if that's not his cup of tea or if that's not his specialization, he'll tell you that I don't specialize in probably suicidal ideation, you should go to another therapist or a friend of mine who does specialize in it. So I think the type of therapy changes based on what issue you have. Also, in therapy world, there's a very important probably consideration before the client or the therapist decide to carry forward the therapy is how both of you resonate, or what's the therapeutic relationship between both of them. Sometimes there are clients who probably don't like working with the opposite gender or a particular age group, or maybe the therapist also has gone through some issue related to what the client is facing in the past. So knowing all that and how to see how the therapeutic relationship evolves also decides if this therapist is good for me or maybe I should switch to a different therapist. So initial first 1 or 2 sessions is just for that rapport building and knowing whether we both resonate at the same pace. So just I digress, but just to kind of conclude, so different issues have different specialized therapists. If it's a basic anxiety, depression, all the therapists are probably equipped to handle small things. But if there are something like some addiction, drug addiction, suicidal ideation, for that you need very hardcore specialist therapists in that.
That's good to know. I think, like, in general, for, let's say, as you said, medical doctors, you could say there is well-known understanding in the society today that there is specialists for each aspect of the body, but maybe it's not as well thought through or known that, okay, there is specialization even in the therapy field. So it's good to kind of understand that aspect. And especially, I think, like, this has been, at least in coming in the news now, that there is so many youngsters who are starting to get this suicidal tendency. And
Mm-hmm.
that's like a very difficult thing to deal with for anybody.
Yeah.
And I'm getting also that understanding from you that, it's important to not solve the problem on your own, right? Like, there is for example, if somebody had a heart attack, they would not deal with the heart attack on their own. They would go to a specialist doctor. So sometimes, at least this was my, you could say, struggle before that, because not knowing this therapy and all these tools existed, sometimes dealing with problems on your own is quite overwhelming. And
Yeah.
that's something I kind of understand from you, that we should go and seek out help from the specialist rather than dealing with problems on your own, right?
So people have different notions, like especially in India also, parents believe that, just by telling the kid to wake up early, do some yoga, do some walking, eat healthy food, the kid might come out of depression. Or they might have, especially males are kind of made to believe that you need to be strong, etc. So of course we are evolving as a society also, but different societies and cultures hold different beliefs about going to a mental health. And probably that's why many of the issues sometimes go unnoticed or sometimes are ignored until they go to a stage where you really need to go to a psychiatrist. Basically, a psychiatrist is a person who prescribes medicines. That's called as psychopharmacology. A therapist is one who does therapy like counseling and talking, etc. So that's why many issues go undiagnosed, unnoticed until they get to a level or cross the threshold. I think different social cultural beliefs do impact, I think, one's perspective towards mental health. Even in India and even in abroad, I have seen it happen uh, quite much.
Got it. So switching gears here, basically, there is like you could say there's a big portion of marriages breaking now in Western world. There is 50%. In I think India, I don't know if we have an official statistic yet, but you know, different couples either before pre-children, post-children, going through very, very tough, you could say, pairing as a couple and then having bad impact on each other. When should couples explore therapy and what's the right kind of time and situation to kind of go through and heal? And even when should children also or explore therapy in a bad family setting, right?
Yeah. So I think the easiest answer to it would be earlier than they realize that the marriage is falling apart. Now the world of couples therapy is also has changed very drastically. We had couples coming probably once they start, experiencing friction in the marriage and they see it's not working, etc. They used to come to us. Then now we have couples who are a bit more educated and a bit more aware. They start coming post marriage, maybe just to start working with the adjustment with each other. But also now there are people who come pre marriage, trying to kind of prepare them for what lies ahead, especially when marriages between two different people. Then there is social differences, cultural differences, financial differences. So just working from there, kind of preparing the mindset, preparing what lies ahead, and then kind of building it from there.
This is interesting, right? Like talking through experience here, like there's a maybe lot of, you could say, unknown childhood trauma that the baggage people bring from their past into the relationships. And sometimes as an individual in a relationship, it's so, you could say, difficult to admit that, hey, I am carrying this much baggage that I need to really, really work upon. Because sometimes there is nothing wrong with your partner. It's just maybe your unexplored, unhealed childhood problems, unhealed baggage that you're bringing, and you are kind of having a detrimental effect on the relationship. And that defensiveness, that lack of, you could say, awareness, ego to really work on yourself. How can a partner, let's say, a healthy partner dealing with this kind of unhealthy partner, how can they make it work when the partner is not willing to, let's say, heal themselves and make themselves a better version of, right?
I think the insight comes from the inclination or from the desire to make the relationship work. If there's that strong relationship, even in the dysfunctional partner. Now we are labeling it dysfunctional because, of course, couples theory doesn't believe in that. Both of them are contributing to the dysfunction in some way or the other.
Yeah.
But if the dysfunctional partner has that insight and that inclination or probably the desire to make the marriage work, then I think slowly the insight can be brought in. Maybe through a friend or maybe going through a basic couples counselor or through a family member. And probably then the path to getting into proper therapy can begin. But it's very difficult to kind of, you know, pull the relationship based on only one partner's probably need to make the relationship work. Both of them need to have that, need to make it work. Yeah.
Yeah, totally. And as I think, as you're describing this, I'm kind of thinking like that quote, right? Prevention is better than cure. So rather than dragging on problems too long, as you rightly said, it's better couples, be aware that, okay, there is need to kind of heal and make it work and, approach the right therapist rather than dragging the problem and, breaking the relationship unnecessarily.
Absolutely. Earlier things are done, the lesser the time is needed to kind of sort things out, the lesser is the effort needed, and from all the three parties, and the couple as well as the therapist. And kind of also, once it reaches a threshold, then sometimes repair is also not possible. So it's better that it's done as soon as possible.
Yeah, agree. So this is also another, you could say, thought or finding or just talking to people around. There is like, obviously in the West, I see a lot of therapists just being like this yes person that they just can keep acknowledging the problems and not keeping their clients accountable on their own growth. But in general, there is like lack of, you could say, patience in the young generation today. So, and obviously experiencing therapy myself, like I know healing takes a lot of time. So how can somebody, have that thought or understanding that, okay, I need to give this time to heal, even because the physical wound also takes a lot of time to heal. So a mental and emotional wound is obviously unseen and takes a lot more time from what my experience says, right? So how can one develop this right attitude? Because even if okay, I have a problem, but sometimes people just lack the patience, and maybe they also, this is also another thing that I see, that people think like, oh, what am I doing? Just spending this money, just kind of venting. I mean, that's the notion. So how do you correct this notion?
Yeah. So I think therapy is also a very healthy blend of all the things that you have mentioned right now. It might involve some amount of venting. Some therapists give that space for the venting to happen in the initial few sessions for a limited amount of time. But it's like you are cutting a river bed. So some amount of flow will still continue to happen. Some amount of venting will keep on happening. Then eventually the therapist will slowly cut the riverbed to kind of divert the flow of emotions or thoughts or the relationship in an opposite direction. So it happens very slowly. And of course, it's therapist skill to kind of do it slowly and give it to you in a doses that's needed. But yeah, there are few therapists who can go into the mode that you have mentioned. But rather than commenting, it's probably commenting on their skills. I would say it's probably different schools of thought give different amounts of time to venting and then starting the process. There are people who do sessions twice a week. There are certain schools of thought, and that goes for an year or so, but that's needed because that will help you kind of release everything that's stored, and then it goes right up to the childhood to understand the traumas and your inclinations. So I would say different schools of thought work differently.
Got it. Okay. Okay. That's good to know. It's also, I think, what you're describing, um, kind of like how dating requires, like, okay, you meet different people to really know who you'll gel along with. Similarly, therapy, you could say, is like, in that sense, you need to, and you were saying, right, like have that kind of connection with the therapist to really trust them, to work with them. So that also requires some, you could say, patience to explore and know which therapist to work with, who will help you heal in the journey, right?
Yeah. So it also, see, because it's all about mental health, some people also go on the other extreme. They just keep on switching on, therapists to find a therapist who comforts them and who kind of agrees to whatever they are saying. That's also probably one of the things that we observe in people. So like me and few of my friends said that if you are starting with therapy with me, at least stay on for 8 sessions, okay, or 8 or 10 sessions, and then take a call. After 10 sessions, I will not tell you if it doesn't work. But sometimes what happens is people will do 1 or 2 sessions. They'll say, oh, this is not working. We'll go to another therapist. And this keeps on happening. So it's probably they're looking for a therapist who kind of probably agrees to what they're saying or comforts them or something that they're looking in the therapist that they're not getting it from a particular therapist. So therapist shopping and hopping is also very common. Yeah.
Yeah. I think that folks in today's society kind of lacking persistence and patience to really work on is kind of like, maybe a side effect of the social media now, that people just are impatient to find and see, like, okay, it benefits them, right?
So that's what I think. That's why insight is very important. The client knowing that they really need to work on it. The client knowing a bit that they're resisting a therapist probably because the therapist is aversive to their thoughts or something of that sort. So before even deciding the resonance, having a bit of insight is also equally important, especially for in the modern context.
So it would be great to kind of also get a little bit more, let's say, testimonial stories about how you have worked with different, you could say, range of people, that people also can understand when they can, let's say, connect with you, and what scenarios they should actually kind of start working on this aspect, right? So maybe if you can walk us through some examples, that would be great.
Yeah. So I think I work with quite a few different types of cases. I work with trauma cases. I work a bit with couples therapy also. Of course, it's not my forte to work with couples therapy, but during the course of my therapy, I also, if you're working with a client and suppose then a couples issue comes up, then definitely we have to include the spouse also into therapy. So I also work with normal confidence issues, etc. So I don't know where to begin with, but so one of the cases, one of the few cases that I work or I specialize with is how the childhood trauma kind of conditions your or your childhood upbringing conditions your current day responses or your current day interactions with different aspects of your life. So I have this client who had a very dominating in the sense dominating verbally, abusive physically, verbally, etc., etc. And she stayed in a constant fear of the mother abusing her or kind of physically or verbally. Even her marks decided how much amount of hitting she will get, etc. So the mother, of course, in the Indian context, the mother wanted to do it for her good, but then she always lived in this fear, and she used to be aware that when the mother is walking, she used to hear her footsteps. In India, we wear those piles, etc.
Yeah.
And she used to go into her room and start studying and be fearful and close the room. And there was lot many things that happened in her mind at that point of time. And today, when we work with her, it shows how she's fearful of her husband, how she's fearful of her, going out in the society, talking to people. Her own brother also has depression in the sense the effect kind of also was seen in his brother, in her brother, but she doesn't have a big social circle. She doesn't feel confident enough to talk to people. The relationship is also a mess because she's also not working because she's not able to stand up for herself at her workplace. So it's basically, a very low confidence. There's a constant fear of what people will think of her if she's saying something wrong and people might not, agree to her. So that lack of confidence or that fear is, kind of has got carried forward and now we are seeing it in different aspects of her life. So that's one case probably that shows how childhood trauma can impact your current life scenarios in different ways. Now the mother is out of picture, but still the work is affected, the relationship is affected, her social circle is affected. So that's one of the cases. We also see, I am also working with a couple. So of course, here I started with the female first for her issues, then the husband came in, and now we are also doing couples therapy. So this female also, her father was a perfectionist. So she was conditioned to do things perfectly, whether it's work or keeping the house, etc. And she feared her father's anger. And now we see how now this is the opposite. This is the bang opposite of what we saw last time. Now she craves for perfection in every aspect of her life, whether it's keeping the house, whether it's a relationship, whether it's her kids. And the issue is burnout because as a single person, she's not able to handle so many aspects of her life in that perfect mode. What happens is then she gets frustrated, irritated, angry, and then she becomes angry on her kids, husband, and her people around her. So this is the opposite. Like the person is taking forward that uh, maybe training from the childhood, the traumatic training from the childhood, and imposing it on others. So these are the two cases that probably come to my mind right now. Of course, we deal with addiction cases, addiction to porn, addiction to social media. I have another case of addiction to social media. Like a doctor came to me and was addicted to social media. And when I found out the wife, the relationship between the husband and the wife is not great. The wife is too demanding. The wife has too many expectations. She's too bossy. They don't gel well. Both of them don't gel well. So for the husband to not listen to the wife or to get away from the wife, the best way is to engross himself into social media. So it's like cutting out that 2 hours of hearing or that dysfunctionality by kind of being engrossed into social media. So many cases. So maybe I'm not able to kind of think of many, but these 2 3 things. Of course, depression, anxiety. So yeah, definitely we work a lot.
Yeah. It's, as you're describing it also, it's coming to my mind like maybe 50 years back, India and let's say the whole world as a society, the economic situation was very different. Now the economy has maybe strengthened a lot, but it's kind of strange. And also in a way, we are seeing so much, you could say mental health issues popping out. I mean, the work you and so many other good therapists are doing out there, it's like repairing that society, right? Like, so in a way, I would say it's a lot of thankless work that goes behind the scenes because you are kind of repairing something that has been broken for many, many years. So what you're describing, I mean, I would say just also personally working with you, it's like a lot of gratitude to you and a lot of other wonderful therapists out there who are doing such amazing work healing the society, because the society is in a bad situation. It's unfortunate that so many people are even unaware of their mental health problems, what to speak of working on them and actually addressing them. And until unless all of the people really work on it, I mean, we talk a lot about, let's say, wanting spiritual progress, but at least my thinking and understanding going through therapy is like spiritual progress is also impossible if you don't have a amazing mental health. So having good physical and mental health is like a prerequisite in my mind to really working on your spiritual health. So kudos to you. Thank you for what you do. And, I'm hoping that our listeners will at least get some small glimpse into the world of therapy, and, when they should get in touch with you and kind of start working on their, you could say, individual healing. And hopefully that every individual that heals, that makes the whole family heal. And that way we avoid passing this, what we call as intergenerational trauma, right? So thank you for what you do here.
You rightly said that, the mind is the connecting link between the physics and the metaphysics, that is the physical body and the spiritual world. And if your mind is not sorted, can't do even your spiritual practices. And eventually your mind issues will show up in your physical body in form of psychosomatic symptoms. Sorting the mind is good or needed, even if you are a person who's just working with the body, physical enthusiast, or you are a spiritual practitioner. Both of them need it.
Yeah. Thank you so much. And listeners, we can share some details about Dr. Karan if you want to get in touch with them. But yeah, please work on your mental health. Thank you so much for listening today.
Thank you. Thank you. Thank you for having me.